Falls and falls-related injuries are a major problem for our older adult population and for health service providers. Injuries from falls are numerous, but fractures or bone injuries are the most problematic. Falls-related injuries can have devastating outcomes for older people. Hip fracture is the most serious bone injury. In 2011, it is estimated that there were over 4,000 hip fractures in Ireland, and most of them occurring in those over 80 years of age. The financial cost to the economy is huge, but the cost to the quality of life and life itself is immeasurable. According to the Strategy to Prevent Falls and Fractures in Ireland's Ageing Population 2008, prevention of hip fractures is a priority. As a care facility for older adults, St Mary's is making it a priority by developing and implementing a falls prevention programme, Forever Autumn. Forever Autumn is a campus-wide initiative that aims to heighten the awareness of falls and also to bring ownership of falls prevention to all staff on the campus, both clinical and non-clinical. This resource has been developed to guide you through some of the elements of Forever Autumn.
As part of the review of the falls prevention and management policy, a new falls risk assessment tool is being implemented across the campus. The assessment tool chosen is the Falls Risk Assessment Tool, or FRAT, developed in 1999 by the Peninsula Health Falls Prevention Service. The FRAT tool has been evaluated as a reliable and valid tool and is used internationally. A falls risk assessment will be carried out on any person with any degree of mobility who is admitted to St Mary's campus. Any person who is immobile, i.e. has no mobility, is not considered at risk of falling and therefore will not require a falls risk assessment. A member of the nursing staff will be responsible for carrying out this assessment at the time of admission to St Mary's. The assessment will inform staff on what measures are necessary to reduce the risk of falls while the person is a patient or resident in St Mary's. The assessment will identify if the patient or resident has any factors that may increase their risk of having a fall. The FRAT comprises of differing sections: the history of falls, falls risk status, risk factor checklist, and action plan. The history of falls section will inform staff of any falls the person has had prior to admission. It also captures the nature of the fall and any known contributory factors and details of injuries sustained. Any injuries should be recorded under the comment section. If there have been any changes to functional status and/or medications that have the potential to cause falls, this should also be captured in the comments form. The falls risk status allows identification of the likely risk of another fall. It gathers information on recent falls, medications, psychological factors, and cognition. To assess cognition, the nurse undertakes the abbreviated mental test. The result can impact on the risk of falls if there is evidence of impairment. The risk factor checklist will inform the nurse if there are any problem areas that may contribute to the risk of falls. This will allow interventions to be put in place to reduce further risk. This section may need to be completed after a period of observation of up to 72 hours after admission. The combination of scores between Part 1 and Part 2 will give an overall falls risk score. An example can be seen here, where the combined score of 15 puts the patient at medium risk of falls. The action plan will determine which leave is appropriate for each patient or resident and what measures need to be taken to reduce the risk of falls. It is at this point the Forever Autumn programme is initiated. Some of the Forever Autumn symbols that you may see are small sticky labels of the corresponding leaf affixed to the front of the patient or resident's medical notes and on the whiteboard next to the individual name. The purpose of these is to alert all clinical staff of the falls risk status for individual patients or residents. Other Forever Autumn symbols you will see are large non-adhesive labels of the corresponding leaf affixed to the wall outside the door of the patient or resident's bedroom. In multi-occupancy rooms, the symbols should also be placed above the individual beds. The purpose of these is to alert all clinical and non-clinical staff at a glance of the falls risk status of individual patients or residents. Where appropriate, amber and red grips should be affixed to the mobility aids of patients and residents. You will see on the image to the left that an amber grip has been placed on the walking stick of this resident. The purpose of these is to provide an immediate visual alert to all clinical and non-clinical staff of the falls risk status of individual patients or residents, particularly when they are away from their rooms. Carrying out comfort checks on a regular basis throughout the day has shown to reduce the incidence of falls by preempting the needs of a patient or resident. Looking after these needs prevents the person trying to see to themselves, and therefore reduces the risk of a fall. It is the responsibility of the ward or unit staff to carry out comfort checks at regular intervals throughout the day. Needs that can be met include toileting, positioning, pain control, provision of drinks, turning the television on and off, etc. A record of the comfort checks is kept on each unit or ward. Each member of the care team is responsible for the needs of the resident and patient in their team. In the event of a resident or patient having a fall, a post-fall review must take place. Ideally, this should occur within 30 minutes of the fall or within the shift duration. Any new interventions implemented following the post-fall review and/or multidisciplinary team meeting must be communicated to all staff in the care team. A post-fall review involves as many members of the care team who were on duty at the time of the fall as possible. It may also include the patient or resident if appropriate. The purpose of this is to reflect on how and why the fall occurred, and to identify what interventions are required to reduce the risk of a subsequent fall. If any resident or patient has 3 falls within a period of 3 months or less, a multidisciplinary team meeting should be arranged to discuss the resident or patient's further management. It is important to note that all patients or residents who have a fall are automatically deemed as being at high risk of further falls, and the colour of their leaf may change to red.
This resource provides information on different elements of the Forever Autumn programme. The new Falls Risk Assessment Tool, Falls Risk Symbols, coloured leaves and grips, the establishment of comfort checks, and the post-fall review. It highlights that the responsibility for the reduction of falls risks to our residents and patients lies with all staff, both clinical and non-clinical. The role of each staff group has been clearly defined. By implementing the measures outlined in Forever Autumn, it is envisaged that the risk of falls for our patients and residents will be reduced. If you would like any further information about this project, please look at our website www.bonehealth.co.